My name is Mackenzie. I'm going to be the pediatric nurse practitioner student that's going to be assessing me today. If it's okay with you, I want to go ahead and get started. First, we're going to start with the cardiac assessment. I'm just going to be looking at your chest for any abnormal movements. No lifts, heaves, or impulses were noted. Next, I'm going to go ahead and palpate your pulses. First, we're going to start with your carotid, brachial, radial, dorsalis pedis, and posterior tibial. Okay, all peripheral pulses were +3 bilaterally. Next, I'm going to go ahead and assess your cardiac sounds with both sides of my stethoscope, starting with the diaphragm, aortic, pulmonic, Erb's point, tricuspid, mitral. So S1 and S2 were regular and rate and rhythm. No S3, S4 murmurs were heard. Next, I'm going to go ahead and move on to the respiratory assessment. I'm just looking at your chest and any movements. So chest is symmetrical and normal in shape and size. AP to transverse diameter is 1 to 2. Breathing is regular and non-labored, no use of accessory muscles. Next, I'm going to move on to percussion. So I'm just assessing for any abnormal noises heard over your lung fields. Okay, and then move to your back. Striking third finger. Okay, so resonance was heard anterior and posteriorly bilaterally in the lung fields. Next, I'm going to go ahead and assess your lung sounds. Every time I put my stethoscope down, if you don't mind just taking a deep breath for me, that'll be helpful. Okay. Okay, and back. Okay, lung sounds were clear, no adventitious breath sounds were heard. Next, I'm going to go ahead and move on to the GI assessment. I'm going to have you lay back, roll up your shirt. Okay, so abdomen is symmetrical, no lesions or masses noted. It is flat, non-distended. And then I'm going to go ahead and move on to listening to your bell sounds. Bowel sounds were active in all 4 quadrants. Next, I'm going to go ahead and assess for skin turgor. I'm just going to pinch an inch of your skin. Perfect. Skin turgor was normal. It was elastic. Next, I'm going to go ahead and palpate. So I'm going to start with light palpations. You're not having any abdominal pain right now? Okay, good. If any of this is uncomfortable, please let me know. Okay, now deep palpation. Okay, abdomen is soft and non-tender, no guarding noted, no masses noted, and spleen was non-palpable. Next, I'm going to go ahead and percuss. Okay, tympany was heard in all 4 quadrants. Next, we're going to go ahead and move on to the musculoskeletal assessment. So I'm just looking at your skin and the skin around your joints. So no redness or swelling noted, no rashes or lesions, and skin is appropriate for ethnicity. Next, I'm going to assess your muscle tone. So you can just relax like this, and I'm going to do all the movements. Okay, no rigidity was noted out there. Okay, normal muscle tone in upper and lower extremities. Next, I'm going to go ahead and assess your range of motion and strength in your upper extremities. Have you shrug your shoulders? Okay, resist the pressure. And then I'm going to have you flex and extend your arms. Resist the pressure, and then resist the pressure. And then I want you to roll your wrists inward, roll them out, make a fist, fan them out, squeeze my fingers. Great. So full range of motion and 5 out of 5 strength in shoulders, arms, and hands. Next, I'm going to go ahead and assess your legs. So if you can flex and extend those. Perfect. And resist pressure. Resist pressure. And I want you to roll your ankles inward, roll them outward, point up and point down. And then I want you to feel like you're pushing down on a gas pedal and then push up. Great. Now I'm going to assess your hips. So if you can lay back for me. And you just relax, and I'm just going to be moving your legs to the side. I'm bending it. Okay. So full range of motion in hips. Let me also have you sit up right here. And then I'm going to try to pull your ankles apart, and I want you to resist. Okay, full range of motion in hips, legs, and feet. And 5 out of 5 strength in hips, legs, and feet. Next, I'm going to have you stand up. And just looking at your feet. Feet are normal in alignment and pelvic width apart. And then I want you to walk heel to toe. Great, normal gait and balance. Next, I want you to go ahead and bend over and touch your toes. Pull up your shirt, looking at your spine. Spine is straight and midline, no lateral curvature. Okay, next I'm going to go ahead and move on to the neuro assessment. If you want to sit here, I'm going to be assessing cranial nerve 5, which is the trigeminal nerve. I'm going to be assessing sensation. This is soft, this is a Q-tip, and this is sharp. I want you to close your eyes, and I'm going to assess 4 different areas on your face, and I want you to let me know what you feel. Stop. Sharp. Stop. Sharp. Great. Cranial nerve 5 is intact. Next, I'm going to go ahead and move on to the finger to nose test. So I want you to close your eyes and rapidly alternate touching your finger to your nose. Great. So fine motor is intact. Next, I want you to go ahead and stand up. I want you to put your feet together, hands to the side, and close your eyes. I'm looking for any swaying. There's no swaying, so that's a negative Romberg's test. So she has normal balance. And then I'm going to go ahead and assess your reflexes. First, I'm going to start with the plantar reflex, or patella reflex. And that one's really active. Achilles. Great. And then I want you to just move your leg here. This for the plantar. Great. So patella and Achilles reflexes were +2 bilaterally, and plantar reflex is intact. Next, I'm going to have you go ahead and sit over here. We're going to move on to cranial nerve 2, which is optic. I want you to cover your left eye first, and I want you to start over here where it's 20/20, and I want you to read left, right, and then switch to your right eye.
EPTZO?
Correct.
EPTZO.
Perfect. So 20/20 in right and left eye. Then we're going to move on to cranial nerves 3, 4, and 6. Cranial nerves 3, 4, and 6, which are ocular, trochlear, and abducens. So first I want you to just look at my nose, assessing pupils, and then follow my finger out into your nose and back out. So pupils are equal, round, and reactive to light and accommodation. I just want you to follow my finger with your eyes, looking for any abnormal eye movements. No nystagmus was noted. I already assessed cranial nerve 5 earlier, so we'll pass that. Cranial nerve 7 is facial, so I want you to raise your eyebrows, puff your cheeks, symmetrical movements. Then we're going to move on to cranial nerve 8, which is acoustic. So I want you to cover one of your ears, and I'm going to whisper a color behind you, and I want you to say it out loud once you hear it. Red. Blue. Perfect. Then I'm going to go ahead and move on to cranial nerves 9 and 10, which are glossopharyngeal and vagus. So I want you to say ah. Great. Palate and uvula rise midline. And then I want you to go ahead and swallow. Perfect. And then I'm going to assess your gag reflex. Great. So swallow and gag reflex are intact. And then we're going to move on to cranial nerve 11, which is spinal accessory. So I want you to resist pressure here on your shoulders and on this side of your face. Great. And then cranial nerve 12, which is hypoglossal. I want you to stick your tongue out and move it side to side. Good. So tongue is midline and strong protrusion. So cranial nerves 2 through 12 are intact, and that's going to be it for today.